Today, we will be providing wound care and applying a wet to dry dressing. First, you will want to review your orders, introducing self and verifying patient identity, discuss the procedure with your patient. Perform hand hygiene and don clean gloves, provide patient privacy, gather necessary supplies and bring them to the bedside stand or overbed table, assess your patient for pain medications, administer as needed, and allow time for them to take effect. Place a waste receptacle or bag at a convenient location during the procedure. Adjust the bed to a comfortable height. Assist the patient to a comfortable position. Place a waterproof pad under the wound site. Put on clean disposable gloves and loosen tape on the old dressing. If necessary, use an adhesive remover to help get the tape off. After removing the dressing, note the presence, amount, type, color, and odor of any drainage on the dressing. Place soiled dressings in an appropriate waste receptacle. Remove gloves and dispose of them in an appropriate waste receptacle. Inspect the wound site for size, appearance, drainage. Assess if there's any pain present. Check the status of sutures, adhesive closure strips, staples, and any drains or tubes present. Note any problems to include in your documentation. Now we will be cleaning the wound. Wash your hands, set up your sterile field, and prepare your sterile dressing supplies. Pour the liquid solution into the sterile basin. Arrange your field so that you do not have crossover when reaching for supplies. Cut your tape beforehand, placing it on the edge of your overbed table if your policy permits it. Apply sterile gloves. Cleaning your incision itself as ordered. Use a sterile applicator or gauze sponge. Wipe from the cleanest to the less clean in a single downward stroke. Discard the applicator or gauze sponge. If another is needed, use a second applicator. Avoid contaminating the solution with a use of applicator. Applying a wet to dry dressing. Pick up the moist gauze one at a time. Squeeze them out so that they are damp and not dripping. Open and unfold the dressings. Avoid touching other surfaces and avoid touching the patient's skin. Place the dressing in or over the wound. Cover the wound completely. Apply several dry gauze over the wet gauze and apply a surgical ABD pad over the gauze to form the outermost layer of the dressing. Remove and discard your gloves. Apply the tape to secure the dressing. It's 1.5 to 1 inch tape border around the dressing at the top and the bottom. After securing the dressing, label the dressing with the date, time, and initials. Remove all remaining equipment. Place the patient in a comfortable position with the side rails up and the bed in the lowest position.